Hello everyone, and welcome to Moderni Minutes video edition. I am Cynthia PA and owner of Moderni Spine Clinic here in Minnesota. So today is actually my very first video that I'm making for the clinic. So really exciting, also a little nerve-wracking trying to navigate this whole video making experience, but I was urged by my husband and my in-laws to start making some video content for the clinic, talk about my expertise, talk about things I like to treat, my experiences. So hopefully all goes well. If not, I definitely know who I'm gonna say I told you so to, and maybe one less Christmas present I'll have to buy this year. But no, hopefully a win-win situation for everyone. So today I was racking my brain trying to think of what should I talk about for the first episode, and really overwhelmed by the fact that there are so many things to cover in pain medicine. Pain medicine is an umbrella. It is a large umbrella. I'm a golfer, so I'm used to golf umbrellas, but this is a big umbrella. It covers so many different types of ailments, and really we're gonna have a lot of content to cover in the future. So that's exciting. There won't be really any shortage of things to talk about. And that's, just the list that I've come up with. That's not including your experiences that you may have had or questions that you have that we can definitely go over in videos as well. But today, what we're going to talk about is something that I feel is not necessarily underdiagnosed, but underappreciated, not quite completely understood, and maybe undertreated, and that is myofascial pain syndrome. So myofascial pain is likely a word that you have heard of before, and if you haven't, after this video, I am sure you will just hear it all the time. But myofascial pain is really breaking that word down into myo, which means muscle, and fascia, which is a connection piece. So if you're building a home or some type of structure, it can be a connection board that's connecting multiple pieces of that structure together. When we talk about it in the body, we're talking specifically about a connective tissue. So fascia in the body is really ubiquitous. So what I mean by that is it is everywhere in the body. Today specifically, we're talking about myofascial, and so we're talking about the connective tissue between the muscles and the joints and the bones. You'll find fascia surrounding and connecting all of our organs, blood vessels, nerves, so it really is everywhere. And it's mainly comprised of collagen. So it is a very strong connective tissue, but it's also very pliable and allows movement, but not too much movement between organs, between tissues. And so it really kind of wraps and stabilizes everything throughout the body. So it helps transmit, when we're talking about the muscles to the joints to the bones, it helps with transmitting forces equally through all of those. It helps to protect, it helps to keep things in place where they should be. So really how a lot of people describe fascia is the glue of our body. And that's really what it is. So I kind of think of a house of cards. So you take a deck of cards and you pretend each card is something different. So we have one card that represents the shoulder. We have a card that represents the gallbladder. We have a card that represents the heart. A card that represents the sciatic nerve. So one card represents one organ or one structure in the body. You build this perfect house of cards, and it doesn't take much to knock it over. Now, if you were to individually glue all of those cards together into the structure that you wanted, it's going to be much more stable. And that's really what the fascia does. So really there's a whole spectrum of fascial disorders. So if we think of the fascia as having this harmonious balance between being able to stabilize, but also being able to move and help transmit forces properly through the muscles, we can think two different ends. One is when that fascia is too loose or has some laxity to it and it's not stabilizing enough. And then the other side of the spectrum would be if that fascia is too tight and it's not allowing for the proper movement. So if we think of the shoulder, for example, if we think of the fascia becoming too tight or too restrictive due to some type of underlying injury or inflammation, we could think of something called adhesive capsulitis. And that is also known as frozen shoulder. And that's when the capsule that sits over the joint that is made of connective tissue becomes restrictive and it becomes too tight, and it does not allow the shoulder to move throughout its entire range of motion. So that can be a fascial disorder that causes a lot of pain, and that's more on the side of restriction. Now, if we look more on the side of laxity, that can be due to muscle tears, strains, anything that kind of stretches that fascia and that muscle out of its normal proportion. It can also happen with underlying genetic causes such as Ehlers-Danlos syndrome, where the body is not able to synthesize and produce collagen normally. So you have connective tissue that is a little too loose in a sense. And if we're taking the shoulder, for example, again, now that shoulder joint can move its normal range of motion plus more. So it's moving abnormally, and that can cause a lot of joint pain. It can cause wear and tear on surfaces of the shoulder that normally wouldn't get wear and tear. So let's talk about trigger points. Trigger points are something under the category of myofascial pain. So a trigger point is essentially a muscle knot. And this can happen from, and I'll introduce you guys to my dog now. That's Roxy. If she's barking in the background, I'm just gonna say it's probably either UPS, FedEx, USPS, or anything. But she will probably be in a lot of videos. And you know what? I'm not even gonna attempt to edit it out because this is life and we're rolling with it. So trigger points. Trigger points, again, essentially muscle knots. And this can happen just from a day at work where you're additionally stressed, where you're standing or sitting at the computer with a bad posture, you can get and develop muscle knots. This can also happen chronically over time with poor posture, over time with some type of inciting injury. We think especially whiplash injury, or if there's abnormal motion between two joints, that can also cause these trigger points to develop. So again, taking that shoulder, for example, if you have a history of a shoulder injury or history of shoulder surgery, you might have had a movement issue with that shoulder. Well, that can play a big role on some of the supporting muscles that lead to your neck, like your trapezius. It can also play a role on the muscles that line that shoulder blade. So looking at the subscapularis, the rhomboid muscles. So all of these muscles work together. And when you have one unit that's not moving properly, it can lead to these trigger points to develop within these muscles. So a trigger point essentially is a muscle knot that you're gonna be able to push on and it's going to cause you pain. Now, just remember that the pain doesn't necessarily have to be only in that trigger point. We can get a lot of what we call referred pain with trigger points. And that means either pushing on that trigger point and feeling it elsewhere in the body. So commonly pushing on that trapezius muscle back here, or another muscle called the levator scapulae, pushing on that can refer pain up the back of the neck into the head, sometimes into the jaw, or even behind the eye. And so trigger points definitely are a source of pain for a lot of people. And so you'll see a lot of self-help guides out there essentially for trigger points, a lot of tools that can be used for trigger point release. And I'll put in the links down here some of my favorite tools that I've used for trigger point release, especially for occipital pain, so in the back of the head and the upper neck, as well as, like I said, in that trapezius region there. So when we're looking at treating myofascial pain, there's a couple things to consider. One, we have to consider, is it truly just pain that's coming from a muscle knot or a trigger point or some type of issue between just the muscle and the fascia? Or is it being triggered by some other underlying issue? So taking neck arthritis, for example. So you might have arthritis in the neck, and those joints in the neck called the facet joints, they may be inflamed, arthritic, agitated enough that they are causing a lack of movement. Things are inflamed and it's causing inflammation of the surrounding tissue, example, muscles and the fascia, and it's leading to stiffness, it's leading to those trigger points or those muscle knots. Now, thinking of, do we have to treat the underlying issue or can we treat the myofascial pain? So that really depends on what the underlying issue is and what maybe you've already tried. So in terms of neck arthritis, you don't necessarily need to try to treat at the level of the neck arthritis right away. You know, if there's not any significant narrowing in the neck that's causing a pinched nerve, you're not having issues with weakness in your arm, anything like that, we don't need to try to attack the arthritis in the neck. What we could try to do is help with movement, help with loosening that muscle and that fascia and get it to move better together. And that can be done with physical therapy. It can be done with chiropractic care, massage therapy, or myofascial release. Other options that, as we kind of move down the spectrum from least invasive to more invasive, would be doing something called trigger point injections. And so it's really what the name says. We are injecting into that trigger point or into that muscle knot. So we're trying to disrupt that muscle knot with a needle and medication. And usually the medication that we use is some type of anesthetic or numbing agent. So a lidocaine, a bupivacaine. And what that does is it provides immediate relief due to the numbing medication, but it also helps disrupt that muscle knot. And we're trying to restore a normal balance really to the muscle by getting in there and disrupting things and getting the muscle almost to reset. So I always kind of describe it as we're taking the needle to go in and hit the reset button. And that combined with physical therapy or hands-on therapy can be very helpful for myofascial pain. Other things like cold laser therapy, it can also be really helpful. And sometimes depending on the chronicity of the myofascial pain, Botox can also be used as well. If the pain continues to come back and it's not responding well to these less invasive therapies, or we feel like we're doing them more often than we need to, you know, because coming in for multiple visits is time consuming, it can be expensive. So if we're finding that these therapies are not lasting as long as we would really like, there are other things then where we would look into treating more of that arthritis in the neck or the underlying issue that is causing the recurrence of this. But it's not necessary to jump to that right away. Now, there are maybe other scenarios, such as if we're talking about the shoulder, a rotator cuff tear, frozen shoulder, adhesive capsulitis, things that may need more aggressive treatment for the underlying cause of the myofascial pain. And if the underlying cause is then treated, then doing some of those other minimally invasive therapies on top of that might help as well. I want to show a couple pictures here of fascia. So if you've ever cut a chicken breast, which I'm sure a majority of you have, that thin layer of tissue on top of that chicken breast, that is fascia. And so you kind of see when you cut a chicken breast how it completely envelopes almost every part of the chicken. So I wanted to show you a picture here of a muscle so you could really see that relationship between the muscle and the fascia. And so a muscle is almost like a Russian nesting doll, where it's something inside something, inside something, inside something. And all of it is wrapped in fascia. So we have the muscle itself, again, wrapped in fascia. And then the muscle is made out of individual fascicles. And so if we were to pull a fascicle out, that is also wrapped in fascia. And then what makes up the fascicle is going to be the muscle fibers. And so the muscle fibers, and then those are made of myofibrils. So everything is almost individually cellophaned, if you will. So it makes sense that we understand fascia to a point, but it also makes a lot of sense that there's still a lot to learn about fascia and its role in the body and its role in pain. But this, I think, is just a really good start to kind of crack the surface of myofascial pain. Please look at the links below again for tools and tips that I use to help treat my myofascial pain. And again, you know, physical therapy, chiropractic care, massage therapy, and looking at something as simple and minimally invasive as trigger point injections sometimes is a good start. Really work with myself or work with your physician or your provider in finding out what the underlying issue is to your myofascial pain and deciding where to start in that treatment path. So we hope to see you soon at Moderni Spine, and see you later for now.